Hello everyone, I am Ankit and you're watching StudyIQ IAS English channel. Now if you can see from the image behind me, ma'am here, who's a senior citizen, she's getting her Ayushman Bharat card from the Chief Minister of Delhi, her colleagues in the cabinet as well as the Union Minister for Urban Development. But the bigger question is, why is she getting this card now? Because actually the central government had expanded the beneficiary base of Ayushman Bharat Yojana last year. Now the reason for this is actually the previous government in Delhi, that was before 2025 February, was the government led by Aam Aadmi Party. And because of their political disagreement with the central government led by BJP, the Delhi government back then did not implement Ayushman Bharat in the entire union territory of Delhi. And this issue actually became a big electoral issue in the Delhi elections because the BJP party said that it will, if they come to power in Delhi, they will implement Ayushman Bharat in its entirety in the Delhi. Now, since the BJP has come to Delhi, hence it is implementing the Ayushman Bharat Yojana right now. But this political bickering between two political parties, you understand this is not important from UPSC's perspective. But what is important is the scheme known as Ayushman Bharat Yojana. So, in our today's discussion, let us discuss entirely the important features of Ayushman Bharat Yojana. Now, the context of this article is that senior citizens who are above age 70, they can get their treatment done in the empaneled government and private hospitals in Delhi because they have gotten their Ayushman via Vandana cards. And the union government or Delhi government had highlighted that as private insurance companies, they do not cover pre-existing conditions for senior citizens. So these kind of benefits that are available now to senior citizens under the aegis of Ayushman Bharat Yojana, it will be of immense benefit. So in this regard, let us cover in detail about Ayushman Bharat Yojana. Now, Ayushman Bharat Yojana in general has two components. First component is known as setting up of health and wellness centers who have been since renamed as Ayushman Arogya Mandir. Now, these health and wellness centers, these are essentially centers which provide primary health care. What is primary health care? Suppose if you get a small health problem like a common cold and you want to get medicines from a healthcare professional or doctors, you can go to these health and wellness centers which are primary healthcare centers where the staff or the medical staff, they will provide you with the necessary medicines. So these health and wellness centers under the Ayushman Bharat, the government are going to reform and upgrade these primary healthcare centers so as to provide a complete preventive coverage that is available to people living in India. For example, if you have any lifestyle disease or you have any lifestyle based problem, these problems can be sorted in the health wellness center where the staff will actually recommend you these kind of measures or changes in your lifestyle you need to bring so as to prevent yourself getting sick in the future. So this health and wellness center under Ayushman Bharat Yojana, also named as Ayushman Arogya Mandirs, they are primarily institutes of primary health care. Now, to deal with secondary and tertiary healthcare needs, the government has brought another sub-scheme of the Ayushman Bharat Yojana known as Pradhan Mantri Jan Arogya Yojana. And this is basically an health insurance scheme which provides for both secondary as well as tertiary healthcare, right? So suppose if you get sick and you want to get hospitalized in a good hospital, be it both government and private hospital, you can get the benefits under the Pradhan Mantri Jan Arogya Yojana. Now, the benefits under this scheme will be provided by private healthcare insuring companies and the government is responsible for providing the premiums to these private healthcare industry. So in this regard, let us understand basically how health insurance works. Suppose you're a private individual and if you want to buy health insurance yourselves and your name is A. So you go to a company called as XYZ who is offering health insurance benefits and this company says that I will offer you the benefit of say 10 lakh coverage in a year and for that you need to pay premium of how much? 15,000 rupees. And this 15,000 rupees that you pay to the healthcare or health insurance company is called as a premium, right? And by paying this premium for a particular year, the company says that any healthcare expenditure that you make in a year, maximum of 10 lakh rupees, we will be covering it, right? So suppose this person A gets sick and wants to get admitted to a hospital. And suppose the bill of this person at the hospital comes at rupees 11 lakh, right? So he has health insurance which provides for a coverage of 10 lakh rupees. So 10 lakh rupees will be paid by health insurance companies, and this person will only need to pay the rest amount, that is 1 lakh rupees. So this is how you actually reduce your overall healthcare spending. But that doesn't mean that the premium you had paid, and if you do not get hospitalized in a particular year, this premium will not be returned to the beneficiary. So this is the cost that the companies ask you to pay, so that they will offer you this service in case you need it in a particular year. So this benefit is only applicable to the people who are paying premium to the health insurance companies. So in this Ayushman Bharat Yojana, the premium that you'd otherwise pay to the healthcare companies, this premium itself is paid by the government to the private healthcare sectors. So therefore this scheme is a centrally sponsored scheme, which means the premium money that the government is paying, it is shared between central government as well as state government. Understand? And what kind of hospitalization is available? Secondary and tertiary healthcare hospitalization. So in case, God forbid, you get hospitalized, the hospital bill will be settled by the private company, because in your name government is paying the premium to the healthcare sector, right? Now, which kind of people is eligible to get benefits under this Pradhan Mantri Jan Arogya Yojana, which is a sub-component of Ayushman Bharat Yojana? Now, the beneficiaries who are deprived, who belong to poor households, who are involved in a very vulnerable kind of a work like unorganized sector, these people who are deprived or are facing occupational deprivation, they will be identified for socio-economic caste census 2011 in both rural and urban area, and these people only, that is about 10 crore families in India, will be provided benefits under this Pradhan Mantri Jan Arogya Yojana. Understood? Now let me tell you what are the important benefits that are available to the beneficiaries. First, the beneficiaries who will be enrolled under this scheme, they will be provided a health coverage of 5 lakh rupees per family per year, and this is irrespective of the number of people that are there in your family. So suppose if there are 2 people in your family, still you will be getting a 5 lakh coverage in total. And even if you have 4 people in your family, still you will be getting 5 lakh rupees coverage for your family per year. So suppose if a person gets admitted to the hospital and their bill comes at say 6 lakh rupees, so this family will only need to pay 1 lakh rupees, because other 5 lakh rupees will be settled by the health insurance companies. And what is important in this scheme, that otherwise if you go and buy private health insurance yourself, you will not be covered with any pre-existing benefits, because for example, if a person has diabetes or blood pressure and there might be health complication that might be a result of these conditions, those won't be covered by private health insurance companies. But when government is enrolling you on this scheme, all pre-existing conditions will be covered since your day of enrollment. So it does not matter if you have diabetes, it does not matter if you have high blood pressure, or even if you have heart related ailment, all of this will be covered in the scheme. Now, whenever you go to hospitals, that is both private and public hospitals that are available in this scheme, you will not be needing to pay any cash, because this is a cashless service or cashless benefit. That is the bill that you are required to pay. You need not get it refunded, because the healthcare sector or the healthcare insurance companies will settle your bill on a cashless basis. So you need not pay any money or any cash yourself, and this benefits is available in both public and private hospitals across India that are enrolled under this scheme. Also, other benefits are available. Not just your hospitalization is covered, but you understand, before hospitalization happens, doctor might ask you to give certain tests, right? They might take your blood sample, they might take your other bodily samples, right? So all of those tests which happen 3 days before hospitalization, these are covered. And suppose after you are discharged from the hospitals, the doctors might ask you to come again, so that they check up on your health and whether your health is improving or not. So 15 days post hospitalization expenses, be it test related expenses, be it doctor related fees, all of this is also covered under this scheme. So your hospital bills are settled up to 5 lakh rupees per family per year. Your coverage or spending 3 days before hospitalization and 15 days after hospitalization is settled. You need not provide any money up till your coverage, because this facility is a cashless facility and it is available in both public and private healthcare hospitals. And what you need to remember, that all existing benefits are, or all existing conditions that you may have even before, this will be covered from the day of your enrollment into the scheme. Understand the important points. Now let's see the latest update that has happened in this scheme. Now last year, government extended the beneficiary base of this scheme. I already told you, as per the earlier beneficiary base, people who were marginalized, people who were poor, identifying them from SECC census, and the benefits were provided to them. Now government has expanded the beneficiary base to include all citizens in India who are over 70 years of age, regardless of their socio-economic status. So both poor senior citizens, rich senior citizens, all of them are covered now under this scheme, but provided they need to be more than 70 years of age. So suppose if a poor senior citizen whose family is already covered under the Jan Arogya mission, their coverage is already 5 lakh rupees, right? So this family will get an additional top-up cover of up to 5 lakh rupees per year for themselves, especially only for the senior citizen, right? Over and above what 5 lakh rupees they were already getting it. So this additional 5 lakh rupees is available only to the senior citizens of that family, and other people can get their treatment for the existing 5 lakh rupees. And rich people, as their families are not covered, they will be getting a separate 5 lakh rupees coverage under this scheme, right? Now, to get, or so that the senior citizens can get their treatment done in the hospitals, the government will be providing them with what? ID card called as Ayushman Vaya Vandana card, which enables the senior citizens to get access to free hospital treatment. So this is the latest update that has happened to Pradhan Mantri Jan Arogya Yojana, that is expansion of the beneficiary base now to include senior citizens. All senior citizens who are equal to or more than 70 years of age are now covered. If the senior citizens were poor, their family will get an additional 5 lakh top up that this senior citizens can use, and if they were rich, they will get the 5 lakh rupees irrespective of the fact their family is eligible for Jan Arogya Yojana or not. Understand? So this was everything that is relevant from Pradhan Mantri Jan Arogya Yojana. Please do try to solve this particular question. Let me know the correct answers in the comments, and the notes for this session will be available on my Telegram channel called as ATS Live. So you can search it in the top right hand corner of your mobile app, or you can even scan this QR code and this will take you directly to my Telegram channel, and notes I will make them available there. Okay, so this is all from my side for today. I will see you again tomorrow. Until then, please have a very good evening and a very pleasant good night.